This is Dr. Jennifer Vielander. I'm the CMO of Odyssey House, and many of you know me already. And the point of what we're doing today is to provide some education on personal protective equipment, or PPE. We want to keep you guys safe. We want to help you both when you're at work, but also when you're outside of work and when you're at home. So it's very important to pay attention to protective equipment as well as hygiene at work and at home. So we're going to go over some principles about how to help protect yourself. So first we're going to start off talking about mask or face coverings. Then we're going to talk some more about other basic hygiene, and then finally we're going to end with a discussion of gloves. So you may have heard that the CDC is now recommending that all Americans wear facial coverings when they're around other people. I'm currently not wearing any facial covering, but that's because I wanted to make sure that you guys understood me when I was talking, but I should be wearing it right now at work, and I am wearing it at work. This type of facial covering can be anything though. Ultimately, the facial covering is more to protect other people than it is to protect yourself. And in fact, if not used properly, facial protections may actually increase your risk of contracting coronavirus because of the fact that you're going to be touching something to your mouth. We're going to be going over this a little bit more in the next segment, but we want to be very careful about anything touching our face. So this can be, now actually the CDC is recommending that we don't wear things such as N95 and surgical masks when we're out in the community, or unless we're engaged in a high-risk healthcare situation, and that we actually use some homemade coverings. So these homemade facial coverings, we'll have a link for you guys afterwards that kind of shows you how you can use them, but these things can also be things such as bandanas or handkerchiefs. So what we're now going to run is a video from our own New Orleans Health Department's Medical Director, Jennifer Avegno, who filmed this wonderful video about how to put on and take off facial coverings, particularly masks, in a safe way and how to store them after.
Hi, I'm Dr. Jennifer Avegno with the City of New Orleans Health Department, and I'd like to talk to you today about face coverings. What we are learning about COVID-19 is that about 25% of individuals who have the virus might not show symptoms. That means that there is a risk of transmitting it to others even if you don't feel sick. Because of this, the CDC and federal leadership are taking another look at whether or not individuals should wear face coverings in public. Face coverings are different from masks. Masks, such as a surgical mask or an N95, should only be reserved for healthcare personnel. These are individuals on the front lines who are taking care of the sickest patients, and they need the best protection. However, here at the City of New Orleans, we know we have substantial community spread of this virus. That's why we're recommending that when you go out to do your essential activities, like going to a grocery store, picking up medications at a pharmacy, getting your takeout from a restaurant, that you wear a face covering. We're also recommending that employees who work in these essential businesses wear a face covering as well. It's one thing to wear the face covering, it's another thing to do it safely. So what I'd like to do is show you the best way to do this. The face coverings we are talking about should be made of cloth, preferably cotton. We have a great community out there who's been doing a lot of sewing of masks, and we encourage you to keep it up. There's other recommendations that you could use a bandana if you have that as well. I'm going to show you the best way to put on a face covering if you are an essential employee or if you're going to an essential business. What we recommend is that you keep your face covering in a Ziploc bag that can be secured. Every time before you put it on, you should wash your hands thoroughly. This can be with hand sanitizer that's alcohol-based, or even better, 20 seconds of hand washing with soap and water. Once you've washed your hand, take the mask from your clean bag, take the face covering from your clean bag. There are many different styles, but it should cover both your nose and your mouth. You can have elastic loops, or some will be using ties. Put it on your face with clean hands and secure over your ears or tie in the back. While you have your face covering on, don't touch it. Your hands may be touching other surfaces and you don't want to contaminate that face covering. When you're ready to take it off, clean your hands again. Remove it from the ties or loops. Place it back into a Ziploc bag and secure it. If you're an employee wearing one of these at work and you're on your lunch break, make sure you remove that mask as we've just shown. Anytime you go to put it back on, you want to make sure you've washed your hands and put the face covering back on. When you are done with your activities or when you go home for the day, wash your face covering. You can do that by hand washing with gentle detergent and water. Depending on the fabric, you may be able to put it in the washing machine, but make sure that you completely dry it before you use it again. And after washing, you put it in a new Ziploc bag for storage. We're making these recommendations because, again, the health and safety of our residents is of the most importance. These are small steps. They don't replace staying at home. They shouldn't make you feel comfortable about going out in gatherings. All of our other mandates stay in place. These are extra protections for our essential workers who need to be there on the front line, feeding us, making sure we have our medications and everything we need to be able to stay at home safely. So we hope you find them useful, and we're happy and proud of the way you've stepped up, New Orleans. Thank you.
So now we want to move on to talking about just hygiene and protection, how you can protect yourself and your family and your coworkers from coronavirus in general. So we're going to be talking about good hygiene habits such as washing your hands and how we do that. Also a little bit about some of the science behind it and the social distancing that's we're recommending. So we know that the coronavirus can be spread via contact. It can also be spread via respiratory droplets. There's also some concern that there may even be some level of aerosolization, meaning that it can float in the air for a little while. So that's why they are pushing that we do wear masks or facial coverings at this point. But that's also why it's important to observe social distancing. So as much as possible, we are recommending that people spend at least or place themselves about 6 feet away from other people. We also want to make sure that people are avoiding any kind of social gatherings now. The general guideline is anything, 10 people or above is considered to be something that is a high risk potential transmission situation. However, we'd advise you to avoid any social gatherings as, if at all possible. So basically keeping 6 feet away from yourself between you and someone at this grocery store, as well as, even at work as well too, anybody who's outside of your immediate family who you live with. So one thing we know is that whenever the only way you can get coronavirus though ultimately is through your mouth or through your nose or through your eyes. So even though we do worry about touching things that may have coronavirus on them, we are unlikely to get it unless we then touch our face, or we touch something that we then put on our face or put in our face. So it's very important to wash your hands. So it's very important to wash your hands and to make sure you wash your hands thoroughly. Odyssey House's own Amy Bosworth will give us a demonstration on how to wash our hands. So first off, you definitely want to use both water and soap. Now there are shortages of hand sanitizers, but ultimately what's found is actually the mechanical act of rubbing your hands, rinsing with water, and using that soap to help dissolve the germs on your hands is by far more effective than using a hand sanitizer. You want to wash your hands for, I'm talking for a very long period of time, but basically you want to wash your hands for ideally about 30 seconds. One way of telling how you've washed your hands for a long enough period of time is try picking a song that you may know pretty well and then timing how long it takes to sing that song and then trying to do that for about 30 seconds. So what they found is actually the happy birthday song should be sufficient if sung twice, should be sufficient amount of time for you to have washed your hands. So again, try picking a happy birthday to you. Happy birthday to you. Happy birthday, dear Amy. Happy birthday to you. And doing that twice should be enough. Now, Amy has already been washing her hands for a while, so I think at this point it has been over 30 seconds that she's been washing her hands. But notice that Amy was washing all surfaces of her hands too. So you want to make sure not only are you doing it for enough time, but you are actually getting into all the surfaces. So make sure you're watching between the fingers, the tips of the fingers, the backs and the fronts. Whenever you touch anything else after your hands have been cleaned, that you do not want to touch your face or your eyes or your mouth. In fact, actually, if you're touching any of those things and then touching something else, you could be spreading germs. So again, before and after touching your face, touching your eyes, touching your nose, your mouth, you want to wash your hands. Also, before doing anything that would then involve your mouth or your face, such as even brushing your hair, brushing your teeth, eating food, you want to wash your hands before and actually after as well too. Now we're going to move on to talking about gloves. As we mentioned before, the coronavirus can be spread via contact, so it's very important, again, to wash your hands. But what happens if you're going to be engaged in some kind of high-risk activity when you want to wear gloves? It probably is a better idea to have your hands covered with something, particularly if you know that you're going to be interacting directly with a client. You're going to be interacting, maybe taking their temperature or performing some kind of test, maybe administering medications, giving them food. If you're going to be engaged where you're going to be in close contact with somebody or providing care directly to somebody, it is a good idea to wear gloves. One thing that gloves are not good for is wearing them all day long to protect you against the virus. You do need to change them between every contact. So wearing a pair of gloves and then helping somebody with it, but then moving on to a totally different activity with the same pair of gloves and then going on to something else, you're basically just spreading around the same thing. It's as if you're just using your hands and not wearing gloves to begin with. So it's very important to take between every high-risk activity to take the gloves off and wash your hands again. So we can talk a little bit more now about how we put on a pair of gloves. So again, don't wear the same gloves all day long, because then it becomes very similar to it's basically similar to just having, your hands and then not washing them. So it's important to change them. But if you are going to put on a pair of gloves and you need to put them on, putting them on is not the hard part. In fact, actually, we can show you right now. We're going to bring in Miss Bosworth again, who's going to show you how she has a pair of gloves on. Okay, so she's been doing some kind of clinical care with some patient, and now she needs to take them off. So she's going to show you exactly how to do it. So you want to grab with the glove on one hand, you want to grab the outside of the glove and then pull it off. Very good. Now what you want to do is take that clean hand, because now that was covered up, and you want to slide it underneath the other glove and then pull it off, and then take both gloves together and throw it out immediately. Notice though how when she had her bare hand, she did not touch the outside of the glove. She slid her finger inside the glove to pull it off.